What's up, everybody, and welcome back to another installment in the Owens Recovery Science Podcast. This is Kyle Kimbrell, and I wanted to tell you a bit about the podcast today, as well as tell you where we will be in the next several weeks. So today's podcast was a ton of fun to record. We had a bunch of laughs and learned a little bit as well, and so that's just always the best combination, in my opinion, is a bit of laughter and a bit of learning. So if you are a procrastinator, you have not signed up for our course in Kansas City this weekend, there will be a few hours left to do that by the time this podcast comes out on July 16th. So feel free to sign up and enjoy the course there this weekend. After that, on August 1st, we'll be in two different spots. We'll be in Falls Church, Virginia, and we'll be in Memphis, Tennessee. So those courses are looking good, and we look forward to being there. And then on August 15th, we'll be in Golden, Colorado at our friend's spot, Next Level Sports Performance. Great place, great people, guaranteed to be a good time. No idea if we'll be able to grab a beer or anything after, but if we can, we will. Then we'll be in Austin, Texas on August 29th. I am firmly convinced, this is my opinion, this is not medical advice, but I'm pretty sure that Texas barbecue brisket will cure coronavirus. So take that for what it's worth, but it's just my opinion. And then we're going to kind of go on both ends of the country on September 12th. September 12th, we'll be in San Diego, California at PRN Physical Therapy, my buddy Sean McCune down there. And then we'll be in Long Island, New York at St. Charles Hospital, their sports medicine group run by John Ebinger and Keith Levinson. Great guys, been doing BFR out there for a while. Good follows on Instagram and Facebook and all of that as well. And then after that, on September 26th, we'll be in Minneapolis, Minnesota, as well as Little Rock, Arkansas. So a couple different places on September 26th that you can find us. And that's enough for now. We don't need to tell you about everything going on in 2020. Obviously, we'll be abiding by CDC guidelines and whatever else we need to abide by to make these courses safe for everyone that is there. And we look forward to seeing you there. So on today's podcast, we have Sherry Johnson. Sherry is an equine sports medicine veterinarian. Yeah, she's working on her PhD. She's doing some BFR research with horses. And today's conversation was just a ton of fun. We all just thoroughly enjoyed it. And we look forward to having Sherry back at some point to tell us what she found out with her research. So for now, sit back and enjoy about the next hour of us just kind of laughing and talking about horses and BFR.
This is the Owens Recovery Science Podcast, hosted by physical therapist Johnny Owens.
All right, welcome back to another Owens Recovery Science Podcast. This is Johnny Owens. We've got our whole crew on here today, and this is going to be a super cool podcast because this is one we've been trying to do for a while. We've been talking about it. I'm going to go over who we have today in a little bit, but here's the first question I have for our group. Who here has actually ridden a horse?
I have.
Yeah.
Kyle has,
like,
yeah.
Really ridden, like not at a fair, you're like on the little, someone's walking along next to you, really ridden a horse.
I'll tell you, I worked at a church camp one summer in college. I'd never ridden a horse before, and I have to take my cabin to the Wrangler, and I think I'm going to drop them off. And they're like, oh, no, you've got to go, Kyle. You got to ride with. I'm like, I'm going to play this cool. So they give me the horse, and as the Wrangler rides away, the person that's going to lead the ride, she goes, hey, be careful with that one. It's kind of skittish. This damn horse is running me into trees and branches.
And were you wearing a cowboy hat?
No, I should have been. I wasn't. I had a baseball.
All right. So the one person I haven't heard say anything, Zach, have you been on a horse? Mr. Philadelphia.
So my neighbor growing up had probably like 4 or 5 horses, and nothing serious, nothing like Kyle there, but we would just kind of jump on and ride every now and then. But yeah.
All right. Well, I'll tell you, I got you guys beat. All right. So I'm from West Texas, Lubbock, Texas, and so I have some cousins that my dad would punish me with every now and then and send me to go hang out with them in Crane, Texas. Sherry, have you ever heard of Crane, Texas?
I have actually.
You have? Okay. You're one of
Yes.
the only people in America outside of Crane, Texas, and those are Crane, Texas. So local yokels, my cousin's there, and my dad sent me there for like a week to hang out with them. And they have horses. I've never been on a horse in my life. I think I'm like 8th grade. And so they get me on a horse and I almost freaking die. It freaked me out. And then on my last weekend there, they said there's like some kind of kids rodeo event, and they enrolled me in this rodeo event. I've been on a horse for like 5 minutes before that. And I was the city slicker because I'm from Lubbock, because we have a mall in Lubbock, so I was like the city slicker because we have, not a strip mall, like an indoor mall. And those bastards, they enrolled me in a barrel racing contest. And I was the only guy in the barrel racing contest. It was just a bunch of young girls like tearing me up, and I couldn't get around one barrel. I swear to God, that's a true story. And I've never been on a horse since. That was the last time I was on a horse. So that being said, today we're going to talk about blood flow restriction and horses and equine, and some really cool kind of concepts and some fascinating things. Before we kind of get into our guest and our intro there, kind of want to just kind of go over things that have happened here recently. COVID's kind of wiped us out. You heard in the intro, though, we're getting ready to start courses up again. Luckily, we have courses starting up in Europe. So if people are interested in attending an Orange Recovery Science blood flow restriction course, check out our website. We've been doing some things virtually. Kyle, you just did something for California. What
I did a webinar on BFR, just kind of an introduction, and then talk basically about what I think we really feel comfortable saying we know, and then tried to lay out, what are we kind of curious about, and then also really, where do we see this thing going, and for us, as we've talked a number of times here, we're really interested in the medical side of things, really kind of getting into these people that are disabled with spinal cord injury and various things as we age that happen to muscle and all kind of different other really sort of intense conditions that people need to rehabilitate from, and can BFR maybe assist in that. So that was for the California Physical Therapy Association. I believe you can go to their website and watch it. I don't know that you really want to look at my face that whole time, so you can just kind of watch the slides. You can listen to audio,
which is what most people do.
They made me have my camera on. I put a little powder on my bald head so the shine wasn't so great, But
yeah, it's not working today. So
yeah, I know.
That's cool. So go check out the California Physical Therapy Association website. They might check it out. I also put out there our APTA monograph just went through final proofs. And so that's going to be up. We all worked on it here as a group. The listed authors on it are me, Dr. Stephen Patterson out of the UK, and Dr. Luke Hughes out of the UK. But it's a big monograph. It's on the APTA orthopedic sections, continuing education site. 311 references. It's a beast, but we're pretty proud of it. I think it's probably the most up-to-date kind of blood flow restriction science monograph that you're going to be able to find out there. And also just want to throw out the PACER project is on YouTube. That was also with the American Physical Therapy Association, the cardiovascular pulmonary section. So if you just put in COVID and blood flow restriction, you should be able to see it. You can get CEUs for it if you go to the actual APTA website and check it out. Although now there's a COVID BFR paper that came out, I think out of Italy. Is that right? Has anyone read that?
Spain. I read it. It was kind of a hypothesis.
Did they steal my crap? Okay.
They launched your video and they put it in a theory paper. I mean, that was,
It wasn't a real strong paper.
Okay, good. As long as mine was out there first, I'm claiming rights. But I'm pretty proud of it. So if you're around, check it out. Or if you get a chance, check it out. Let's see. We're again with the Europe stuff. I just did a big question and answer out in Italy with the Ability Group, who is an amazing group, who's our partners out there. And I think they're going to put that on their website, Ability Group out of Italy. It's probably all in Italian, except for my part speaking with subtitles. But that was pretty cool. We had a really big crowd for that. So
Ben translated for that.
Ben did?
Well, I helped you figure out how to pronounce things.
Yeah.
All I know is I had to look up Tutti because I kept hearing Tutti. It's a Tutti, Johnny Tutti, and I already forgot what Tutti is.
I was wondering when that accent was going to come out. It was
Tutti, Johnny Tutti.
I think we said it meant okay or something, right? Didn't it? It was just something kind of generic.
I think it's all. So it was like thanks all. But yeah, I couldn't stop saying Tutti for a week after that.
So Tutti Frutti is all the fruit then.
Exactly. I'll remember it now. Cool. Anything else anyone wants to talk about? We got courses coming finally, we hope. Wear your mask so that we can start getting out there again and we slow the spread. Cool. Anything else? All right, let's do this. This is going to be super, super cool. So I have Dr. Sherry Johnson on today. She's a veterinarian. If I say vet, is that okay, Sherry?
That's great.
Okay. So she is a veterinarian. She went to Iowa State University, and then after that went to the Equine Medical Center of Ocala, and then she went on to Colorado State University doing a diagnostic imaging for a year. Then she went on to the residency program of Equine Sports Medicine Rehabilitation at Colorado State University. Is CSU like the bomb, like the place to go for equine rehabilitation?
I mean, I think so, Johnny.
Okay, well, I don't know.
Yeah.
All right.
No, they definitely have one of the oldest and most established equine sports medicine residencies in the country.
Okay, that's what I've heard at the orthopedic conferences. So I didn't want to throw out, any fakeness there. And then she's a diplomat of the American College of Veterinary Sports Medicine and Rehab. And basically in the last few years, she's just kind of been crushing it. She has getting her PhD from Colorado State University with a specific research focus on novel rehabilitation modalities related to tendon healing, as well as other things, and multiple awards. So she's received the American Quarterhurst Foundation Young Investigator Award, the Equus Foundation Research Fellow, most recently granted the Stormcat Career Development Award in 2020, Iowa State University's 2020 Young Alumni Award. And she's co-founder of Equine CORE, which I think we'll be getting into as well. And she's a partner in what is Equine Sports Medicine Rehabilitation, ESMR. And go to their website. They've got really cool stuff. Because I want to talk about some of those case studies of these horses before and after. And the pictures you have of their butt, like before and then the next, it's like huge. It's not safe for work if you're a horse on your computer, but
that's exactly what I was thinking. I'm like, I wonder how people look at this like horses, and it's like basically picking up the swimsuit issue for dudes. I think.
Well, it's leading into their Instagram page, so it's kind of more.
Right.
So basically, I can tell everyone was on looking at the horse butts on their website right now.
Yeah.
Doing the research,
Yeah.
Super cool.
And I was so excited to come on today, Johnny, because I knew there would be so many entertaining things said about horses on this podcast that I wouldn't be able to live down.
Well, yeah. Well, we'll try and behave at least a little bit. Sherry, thanks so much for coming on. And obviously, what we're going to talk about is you are looking at blood flow restriction and its application in the equine models. And so, Zach has been working more with you directly. So I know Zach's kind of going to take it with a lot of questions, and unless you get tired of them, and I can clear them out. I control the Zoom on my end.
Okay, perfect. I'm glad to have that option, Johnny.
Cool.
All right, Sherry. Well, I think one of the first things that we can do is probably just talk about the process that it takes to become a veterinarian, and maybe compare and contrast that with what we get out of the medical schooling process for dealing with humans.
Yeah, that's a great question. So to give you guys kind of some background on, the veterinary line of curriculum and what it takes to become a veterinarian, typically students will apply with an undergraduate degree. They don't always have an undergraduate degree. Sometimes they just hit the prereq classes. But for me, I actually did 5 years of undergrad training before I had applied to veterinary school. And then the training itself in veterinary school is 4 years. So typically you do 3 years of classwork, and then your final year is clinical rotations. And when you go into vet school, you learn about all of the species and all of the types of medicine. So parasitology, pathology, exercise phys, You learn about all of those types of things. And then when you graduate and you become a veterinarian, you can ultimately kind of go into whichever area of practice that you want. And for me, once I graduated veterinary school, I always knew I wanted to work on horses, and I always knew I wanted to work on horses with orthopedic injuries. So I don't deal with mares, I don't deal with reproduction, I don't deal with internal medicine, things like that. I strictly work on athletic horses, horses that work for a living and that are considered basically professional athletes. So after my veterinary training at Iowa State University, I went and did an internship. So that's a year of training where you're kind of called a baby vet. You train with specialized veterinarians, and you really just kind of start to get your feet under you. And you can do internships if you're small animal or if you're exotic or going equine, whatever the case may be. But I went to Equine Medical Center of Ocala, just like Johnny said, and did my year-long internship there. And following that, I applied for the sports medicine residency through Colorado State University. And they, at that time, had actually had it as a 4-year program. So you did a year of just imaging training before you actually started the sports medicine residency, which was huge. Because as you know, in the sports medicine field, so much of what you're prescribing for patients and monitoring and diagnosing is based on your original imaging findings. And for horses, we do lots of ultrasound, we do MRIs, we do CTs, we do bone scans, kind of everything that you would be able to offer your human athletes, we also are able to do for horses. So did that year of imaging training and then transitioned into the sports medicine residency through Colorado State University. My residency was a little bit different because it was actually funded by Equine Sports Medicine LLC, which is the big truck, the modified NASCAR trailer practice that I think we're going to go into here in a little bit. So I kind of came out as very much a hybrid of academic and private practice worlds because most of my clinical training was under Dr. Dave Frisbee and Dr. Alan Donnell. And Dr. Frisbee is an orthopedic surgeon out of Colorado State University. And he and Alan actually owned the practice, Equine Sports Medicine LLC at the time. So we would actually go out, the modified NASCAR trailer serves the quarter horse show circuit. So we would go out and support those equine athletes that were in active competition. And then I would come back to Colorado State University. All of my research has been out of CSU. So it ended up being this hybrid of, practicing in the private practice world, but having a very heavily based research focus here at CSU. And once I got done with my residency, my partner and I, Dr. Josh Donnell, actually bought the practice, Equine Sports Medicine LLC. So that's been about 2 years ago, and I transitioned into a PhD program. And the PhD is, kind of what we're here to talk about mostly today, and the exciting things that we have going there.
Yeah. So I think one of the things that's really interesting is when you talk about the NASCAR kind of modified truck and trailer. And I think we have a picture that we'll put up on like the social media to basically show everyone what it is, but it's pretty crazy. So we'll get into that. And a brief story about how I met Sherry was last June, I think it was June 2018. I did a course in Lexington, Kentucky at Bluegrass Orthopedics, and that was the second time I was there. And I'll never forget, I was on the way to the airport, literally on the shuttle to the airport, and I get a text from Melissa, who kind of coordinates all our courses, and she's like, "Hey, we just had a veterinarian sign up for the course tomorrow." And I was like, "Oh, this is crazy." I'm like, dude, I was like, this person has to be affiliated like somehow in Kentucky. And then when I get to the course, like Sherry shows up, and here she's from Colorado, and so we did the course and whatnot. And then she goes, "Well, man, like I'm gonna be in Georgia like next month or at the end of the month, and we can talk about things and maybe try some things out there to see if like this would actually work, because we very limited data, like 2 published papers with equines." And so I show up and I'm like talking to her. I'm like, "Where are you at?" Because the Equine Center here in Georgia is where they did the Olympics in '96. So it's just outside of Atlanta, just east of Atlanta, in a place called Conyers. And she goes, oh, just drive around. You'll see like the big tractor and trailer. And I was like, what? And I pull up, and it is a legit NASCAR tractor and trailer that is a full-on vet clinic. Anything that horse needs while they're there participating in whatever events you guys can do, right?
Yeah, we're really proud of it, Zach. And like you said, it is a modified NASCAR trailer. And, you know, my partner, Josh, and I, we bought the practice. So we didn't have to do any of the heavy lifting on the designing of the truck itself. But that was Dr. Alan Donnell and Dr. Frisbee who had actually, you know, pioneered that practice. So we were fortunate to have bought it, but it's literally a modified NASCAR trailer. We can actually fit 2 horses in it at the same time and work on 2 horses safely at the same time. And everything has been modified for mobile transport. So we take all of the equipment with us, and the dimensions, we actually have a little Nissan Cube car that actually fits up into the back of the trailer. So we'll actually bring the car with us. And I tell people we're kind of like rock stars. You know, we travel around and people pay money to come see us at horse shows. And other people might call us like the carnies of the vet world. You know, you never know. But it's a super cool outfit. We're able to do the really high-end sports medicine stuff. So we have the capability to do the fancy biologics, the PRP, the IREP. We can pull stem cells. We've got our digital x-ray machine. We've got our ultrasound, you know, and everything has kind of been fine-tuned. And we have a whole group of people that help us get to the horse shows and get there safely and set up. And kind of our main guy is a guy named Randy, and he'll probably laugh when he listens to this podcast, but he's the one that drives the truck. He sets it up. He makes sure everything works. You know, people always say, Sherry, did you drive the semi here? I'm like, absolutely not. That's Randy. He actually.
I was wanting to know that, actually. I was going to ask that question of you. I was going to think it was even more awesome if you drove it.
Yeah. No one lets me drive that. And that's a good thing. And one time, you know, I was kind of new to the truck during my residency, and Randy said, do you want to pull the cube up into the trailer? And my eyes got huge, and I was so excited. I was like, yeah, I do. Well, then I realized once you get up in there, how do you get out? We actually have to climb out through a window. So he got a pretty good laugh out of that. But
you got to Dukes of Hazzard that thing.
But yeah, exactly. So
I feel like there was an important part of this story that was left out. I mean, like Sherry, during the course, hearing Zach talk about BFR, I mean, was there a point in time where you're like, well, Zach is such a specimen, such a horse of a human. This must work really well.
Right.
We can probably translate this to horses.
Right. So then we're gonna have to take a few steps back if we're like really gonna do that story justice.
Yeah. Okay.
It's not
that happened in the first break, actually.
Yeah. Okay.
Yeah.
I figured
It's
it happened
not
at some point.
something.
It would be the pygmy horses, the little small ones.
little Shetland pony.
Yeah, short ones.
Okay. Yeah.
Gosh. So here's how it actually.
She came up in the first break to introduce herself, to let me know that she was the veterinarian, and she complimented me on my physique and my training.
Yeah.
Oh God.
Yeah. Stature.
What actually happened?
And so we said, I said, well, Sherry, if we can get the cup around my leg, I have no question that it'll go on a horse's leg. None whatsoever.
Right. Well, and you run at the same speed, and there's a lot of carryover there. You know, it'd be very similar.
So Sherry, what are some horse injuries that you kind of deal with? I mean, I know that's one thing maybe we should share is it's all orthopedics and physiology, and a horse and a human isn't as far off as we think.
Yeah, completely. So, you know, we wear 2 hats within our practice. We do have the modified NASCAR trailer that goes out and helps, you know, the actively competing horses. We also have a home base rehab center that's fully equipped in Whitesboro, Texas. So we're based out of northern Texas, and it's a center where horses actually come to rehab from a variety of injuries. So we will deal with soft tissue injuries, bone marrow lesions, bone bruising, horses with significant osteoarthritis, you know, kind of anything and everything that encompasses orthopedic injuries in horses. they will actually come to our center, and I manage the rehab plans of those horses from the ground up. So we take a very global approach. We manage their nutrition, we manage their shoeing, we manage all of their custom physical therapy that gets prescribed as well. So every single horse in our program has a custom plan that was built specifically for them. And that plan is based on their original injury, the extent of their injury, what they actually do for a living. So similar to you guys, you wouldn't physically rehab a ballerina the same you would as a bodybuilder. There's significant differences in what those two athletes are expected to do. So we take that same approach to the horses. And every single one of their plans is custom built. It's built mainly on physical therapy and targeted strength training. So we work on the biceps femoris. We work on building strength through the middle gluteal, the major pelvic stabilizers. For example, we might work on building strength and flexibility through the thoracic sling and girdle, so that horses from a core perspective are better equipped to protect their legs. So we come at it from a different perspective. We have a pretty unique take on it, but that's ultimately what has made our rehab program much different than other places that are out there. So we work really hard with those horses. We get horses from all over the country. We're very high volume. We're the only veterinary specialist owned and operated center in the state of Texas, and one of only a handful in the country. So we're extremely proud of that. But like you said, there's so many similarities that exist between horses and humans, and especially on the athletic front. Not all horses are built the same. Every single one is different, and they all have a little different constitution, just like your human athletes. The biggest difference with us is obviously they can't tell us when it hurts. They can't say that was too much, that hurt, that session, we got to knock it down. So we as veterinarians have to become really crafty, and it takes a long time and a lot of training to start to flush some of those things out.
I think you're lucky that your patients don't talk to you. Probably.
The owners do enough talking, John.
Yeah, they do. Does the forelimb get hurt more than the hind limb, or?
So Johnny, interestingly, you should ask that. We actually did a retrospective analysis of 10 years worth of lameness data that came from the truck practice, actually. And it's a manuscript that's in the process of publication. So we've submitted it. We've got revisions back, and we're in the process of getting it out the door. But we're trying to answer that specific question about, what are the most common sources of anatomic lameness within Western performance horses? And forelimbs were, the most affected region, but we actually break it down by specific joints on the hind limb, and how often horses presented with different types of lameness. So it's really fascinating, and we're starting to make leaps and bounds on the research end of things about, these repetitive injuries, the bone marrow lesions, the concussive forces, all of that kind of stuff. There's a lot of research being done right now looking into those injury patterns in horses.
Very cool.
When you were talking before Johnny asked that question, you were talking about, the challenge of, understanding and determining when you've done too much or when the horse has done too much in a session. How do you go about teasing that variable out? Because that's a pretty important thing. I mean, because, we get feedback from patients that are like, man, I was sore for, 3 days or, what have you, or I'm completely fine, ready to continue on. How do you tease out when you've done enough or when you haven't done enough?
Yeah, that's also a great question, Zach. So to kind of take one step back to just familiarize you guys with the overall lameness workup on horses, you go to the doctor and you say, my knee hurts, and it hurts right here within my knee. And obviously with horses, we don't have that luxury. So what we do is we go through a process called diagnostic analgesia or blocking, and we will basically perform a series of nerve blocks or joint blocks with mepivacaine, so similar to, getting a dental procedure done. We will actually go in and regionally desensitize certain areas of the horse's limb until we figure out where it's coming from. So if we have a horse that is a grade 3 out of 5 lame at the baseline examination and we desensitize the nerves that innervate the foot and the horse goes sound, then we know it's coming from the foot. And then we have a region that we can then focus on. So once we have that region identified, then we'll typically image it. So we'll shoot x-rays, we might do ultrasound, if it's a long-standing thing, we might pursue an MRI, something like that. So then we know which region that we're working on. And once you get that specific diagnosis as you can, then building the horse's rehab plan in and around that injury then becomes the next step. And we really rely on longitudinal monitoring to assess response to therapy and response to rehab programs. But we also have a few objective outcome measures that we can use for horses. We'll take circumferential measurements, so looking at the overall amount of swelling. We might look at the amount of swelling on the ultrasound image itself. We do use goniometers, so we can actually measure the joint angles and the joint range of motion that the horse is able to comfortably go through. So those are all things that we use. And a lot of it is subjective. Is the horse better, same, or worse actually, and how do we tweak the rehab plan in and around that clinical progress? And it's very much the same as what you guys do on the human physical therapy end, just the main difference being that they can't, verbalize and tell us, although horses do communicate quite effectively sometimes with things they're passionate about. So, but we've had the chance to work with such neat horses that do amazing things for a living and just are incredible athletes. And if you think about it, cutting horses that actually work cattle for a living and do those really torsional movements, they're similar to a tennis player. We have 3-day eventers that do a variety of aerobic and anaerobic activities that are similar to the triathletes. We have sprinters, the same as what you all have. So the intricacies of what that horse does for a living and how we tailor that rehab plan become very important because, I don't rehab a barrel horse the same as I do a Western all-around show horse. Those are two totally different things. And we've been able to learn a lot more about what's successful or not successful based on clinical response to rehab programs, trying to tease that out. And, of course, we like to integrate new technology and BFR. I think the personalized BFR for horses represents that new frontier of where we're headed.
Yeah, we'll get to BFR here next, but the one thing I think that would be pretty interesting, because I didn't know this, and I don't know if Johnny, Ben, and Kyle knew or realized this either, but a lot of the modeling that we have with orthopedic issues, OA, and like you said, like the tendon issues with cutting and whatnot, really kind of stem a lot of from the equine research. I had no idea until, we were talking about that.
Yeah. And it's, from an orthopedic perspective, human orthopedic surgeons and equine orthopedic surgeons have been working together for decades to try to make headway and to try to make progress within what we know about translational orthopedic injury. And horses have very similar cartilage to humans. The equine stifle is analogous to the human knee. Anatomically, they're very similar. And it gives us a way, to learn about both species. And that's really been an exciting part of orthopedic research that we have is, how can we reduce re-injury rates in humans and horses? How can we benefit both species to speed recovery times, reduce re-injury rates, and overall, improve quality of life? And some of the horses that we work with aren't necessarily going back to athletic careers. They might be a stallion who's had a very long, successful career, who's now, being used for reproduction. So on those horses, we're just looking to make them as comfortable as possible, similar to some of your patients as well. And how do we match, all of the workload intensity and that, and I hope we can discuss kind of workload intensity as well at some point on this podcast, because I think that's also a super interesting concept for both.
That's one of the things that I'm really curious about. You're talking about treating these injuries and rehabbing in a similar way. How do you really initiate strength training and you don't have to give away your magic sauce or anything, but what kind of interventions do you do that create that kind of specific load to tissue, and how do you really go about trying to dose
and
that
how do we
out?
get those amazing butt pictures on our website?
Exactly right. That's it.
So there is a difference. There is a secret sauce, and the things that go into that secret sauce, we do have resistance bands for horses that we use. We do have varying levels of weight or strength training that we're able to titrate through a horse's controlled exercise program. I'm also a big fan of the aquatic work, so the underwater treadmill therapy for horses. So not speaking to swimming pools, but actually an underwater treadmill as a form of controlled exercise. And we do have, what we call core strengthening exercises. So the employees, the staff that we have at our rehab center are all quite trained, and they're trained by myself to perform specific exercises that are prescribed for each and every single horse. So similar to you would have someone doing a knee flexion and extension, we have a version on the equine side of things. And we also work a lot on balance and neuromotor control. So we have different balance pads that are different gradients of firmness. And once a horse progresses, we can actually combine those core strengthening exercises with the balance pads. So really, titrating it out and seeing what are the most strength gains and the balance gains that we can get. Because as you know, through any physical therapy program, if you're missing one of those cornerstones, if you make a really strong human, but you didn't focus on the balance, you're not going to have the best end result possible. So you really have to globally treat everything. But yeah, I mean, the trick to equine rehab is getting these horses to do the things you wanted them to do without them realizing you wanted them to do it. So we've got to get really creative about, how we go about doing that. And it's been fun, and it's totally a new frontier. And we're even starting to get as proactive as prehab, so getting these horses in before their orthopedic procedure, before their surgery. So for example, the stifle, which would be analogous to the human knee, we'll actually get those horses in and we'll work on strength training through their biceps fem and through all of those big stifle stabilizer muscles, so that when they do come out on the other side of that surgery, they're more comfortable and they can be stronger to start a rehab program sooner. And I'm a huge believer that the strength gains or the strength losses during a convalescence period are hugely important, and they do delay recovery. So what are the ways that we can keep everything strong and moving and flexible in that downtime? And veterinarians used to think that, stall rest was a thing. And I tell my clients, I'm like, if you as a human patient, you're not prescribed couch rest for an injury. In fact, that's been shown to be detrimental to your tendon injury or to your joint injury. So we've got to be able to integrate ways to physically rehab, but that are safe for delicate or healing tissue. And that's really the genesis of where all of this began.
Yeah, I think that's one of the things, you hear a lot with the quote unquote overuse injuries. Oh, we just need to rice it, just rest, ice, compress, and elevate. And then 2 weeks later, magic happens and everyone's better. And we always say, I say in the course, like, man, you're typically worse off after that 2 weeks of just resting than what you were initially. And the original issue is still there, especially when you start to resume activities. And from the human perspective, I mean, I think, Johnny, that's where BFR came in, is, what do we do? Because we can't load these guys. These guys don't tolerate loading. And so from there but we can't do lightweight resistance exercise because it's pointless. So we're not getting any results. And then that's when we start to see BFR get implemented with low loads, and we get similar results to high load training. So is that kind of the genesis of where you started to develop an interest with equine, with using BFR with them?
Yeah, totally, Zach. So horses, just like your humans, they they experience fractures and they have to go undergo fracture repairs. They experience significant soft tissue injuries that are so severe to the point that they can't actually ambulate comfortably or safely in and around that injury. And so through my PhD, I'm primarily a tendon person, and my whole passion is tendon. But as I've gotten further down the BFR route, I've realized that, the BFR isn't strictly to the tendon necessarily. And the tendon is related to the myotendinous junction and the muscle above it, and strengthening the muscle above it, can that engineer us a stronger tendon in the long run? So yeah, for our purposes, we wanted to be able to help those horses that really aren't physically able to do, not able to experience damaging loads or any form of exercise safely. So how could we strategize the use of BFR as a rehabilitative tool in order to lessen the intensity of the work that we're doing, but still augment the strength gains and still wake everything up from a cellular perspective to keep the ball rolling from a healing perspective? So that was really our genesis of doing this. And I actually was at the Vail Scientific Summit when I very first learned of BFR, and I listened to a fabulous talk by Dr. Brian Noren from University of Kentucky. And I approached him after the talk and said, I think we should be doing this in horses, and we're not right now. And he says, I don't know anything about horses, but I'm happy to help you in any way that I can with the technology and to figure it out. And Adam Ants was at that meeting as well, and I visited with him about it too. And there's obvious anatomic differences in horses and humans, and there's different access to major muscle groups. That's kind of our biggest downfall with equine BFR, is that we can't put it as far proximally as what you all do on the human leg. But it was basically that conference that really got my wheels turning about, could we use this? And I found those two papers that describe, kind of peripherally a variation of BFR in horses, and it wasn't personalized or anything like that. It was a standard cuff pressure. But then I learned about Owens recovery science, and I love custom things. Everything that I do on the rehab end is custom, and I believe that it's best when it's specific to the patient, including pressures. And so then I, found the course in Lexington. I wasn't at a horse show at that period, so I booked it and I went, and I remembered, you guys passed around a sheet of paper at the beginning of the training session, and you said, write down your state licenses. Well, because I travel with the modified NASCAR trailer practice, I have like 9 or 10, states that I'm licensed in. And so I wrote all of them down because I didn't know what
Show off.
And Zach approached my table later, and he was pretty quiet, and he said, are you the vet? And I said, yeah, I am. And he said, you have 9 state licenses. I was like, yeah, it's a different deal. So, but we had actually, at that point in time, can I tell this story now, Zach? Because it's a super cool story.
Yeah, sure.
I'm so excited about that. Yeah.
When I had attended the Owens Recovery Science certification course, I didn't have any clinical experience with BFR like myself. I didn't know what it was, and I very much wanted to learn. But I had also applied for funding for grants to do an equine BFR study. I had applied many times, and I had been absolutely rejected every single time. And it was mostly because I didn't have pilot data. And, it's this perpetual cycle, right? Like if it's never really been done in horses and you don't have but you're applying to get pilot study, but they don't fund you because you don't have a pilot study. It's this really vicious cycle, right? And so Zach and I had some think tank conversations at that meeting about the use of equine BFR and how passionate I was that it can help horses and that we can make a really big difference, just like you guys have on the human side of things. And so I did get a small amount of money then to do a pilot study. And Zach is actually the one who helped me design the specifics around that pilot study, in addition to Dr. Noren from University of Kentucky. So helped me extrapolate a walking exercise protocol for horses, helped me work on the fit of the cuff and getting the LOP readings and, figuring part of that out. But before that had even happened, I said to Zach, I said, well, I'm going to be in Georgia. You live in Georgia. I'm going to be in Georgia for this horse show. Why don't you come to the horse show and let's see if we can get a reading on a horse? That was really the first step. And so Zach comes out, he's got his Owens Recovery Science, earn your deflate t-shirt on and shorts, which no one's dressed like that at the horse show. We got a pony horse. And so a pony horse is a horse that's used to exercise the show horses, for any of you who don't know, from a very good client of mine who was like, yeah, he's great, try whatever you want. And we took the cuff, and I had ultrasound on the trailer as well. So when we got the LOP reading, I just verified on pulse Doppler that the blood flow, went away, and we were able to see turbulence in the vessel, kind of consistent with stasis. And so although we hadn't validated for horses that 80% occlusion is truly 80%, we knew we were getting some level of occlusion. And then we worked to fine tune of how we could get the cuff to stay in place. The horse tolerated it great. We were able to perform, some just test runs of walking exercise. And while I was in Georgia, it was super weird, but I did have some of the best barbecue that I have ever had.
We are
noted for that. Setup. That was a setup.
This is
not unless you found Myron Mixon to come down there and cook.
You just lost your Texas citizenship.
Please, Jerry.
I mean, and
what did you grease the wheels with, Zach? That's what I want to know.
Okay. So anyway,
did Zach promise you? What do we have to do?
Beyond the barbecue that I had, that time period in Georgia of us putting it on the horse for the very first time was huge. So we took everything we had learned from that experience. I applied it forward to the pilot study that we then did about a year ago here at CSU. Owens Recovery Science has been instrumental in helping me figure out the machine, the settings, how I'm going to get this to work. And just so you know, I've had more people tell me that it won't work and it won't be possible than I ever have had tell me that it's a great idea. So, but I'm stubborn, right? And I refuse to believe that this isn't the next greatest thing that we have for horses. So I couldn't be more thankful for your help, the help of Dr. Brian Noren, all of my mentors here at CSU that have been in my corner saying, keep going, keep pushing, because we're in a really cool spot with it.
It was really cool seeing some of those pictures of you trying to figure out LOP and getting LOP. That was, initially, we even talked because Delphi, they do a lot of animal tourniquet work for the DoD, and they haven't had great success with a horse just because they were trying to do stuff on the hind limb, and it was more of a cuff fit. But that LOP wasn't crazy different than a human's LOP. I was like, man, it's probably gonna be like 500 or something because it's such a long limb, and yeah.
Yeah, it's actually quite similar, and that's what Zach and I, we talked about the max pressure that the Delphi unit was able to measure, and we honestly had no idea what was going to happen. I had no idea if the horse was going to hate it. I had no idea if the machine was even going to be able to get a reading. Mm-hmm. The anatomy is just different, and you can tell your human patient, like, lay down and be still while this takes a read, and the horse doesn't give two craps about that. So we have to figure out how that's all going to go. And we still have some work. We're going to validate the LOP readings in my big study that will start in about a month. We're going to validate that and make sure that the reading is that it is accurate, and if it's not, what we need to do, because that reading is super important, and it's been the whole foundation to that the personalized BFR that is the mantra. So we just want to make sure on the front end that we're being as accurate as possible with that.
And while you're getting an LLP, the horse pretty much just standing there. It's got no issues.
Yeah.
It's not freaking out or anything.
Yeah, it just stands, and you can tell the DOD I've made progress on the hind limb situation.
Okay.
But I can't give all my secrets away, but I have been
I
working on
love
it.
the tease.
So,
I love it. Yes.
All right.
That's great.
Johnny, I remember we're in this trailer, and let me tell you what, dude, it was like the beginning of July in Georgia.
1,000,000 degrees.
And we're in this NASCAR trailer, and Sherry's like, yeah, so I got this pony horse coming over, really nice, really good, should have no problems, whatever. This horse was a little stubborn to begin with at first, and then, you know, going back to your question about who's ridden horses, so like I'm just kind of hanging out. So I'm like, you know, I'm the VFR guy here. I'm just, you know, putting it on, whatever.
I'm the cool guy in my shorts.
Yeah. And they're doing all their horse stuff. And Sherry goes, yeah, don't stand behind him. And I was like,
Yeah, dummy.
That's rule number one, Zach. I mean,
Zach was giving me anxiety because he stood right in front of the horse's leg, and I was just like, I can't get Zach killed. Like, Zach has to live through this experience. And we both were so excited when it got her reading. I mean, we lost it. And then, of course, there's a bunch of, you know, people around the horse show that are interested. They're seeing us doing this stuff. And then they say, well, what is this? And even our resident, you know, he wanted to try the BFR. So the next thing I know, Zach has got him in a cuff and he's doing quad. And I'm like, we gotta get back to work. Like, what's happening here? And then afterward, you know, I had to hear him complain the whole day about how tired his legs were after the day.
So are you working with Brian Noren still? He's a good friend of ours, and I know he was initially there. Is he a consultant?
He's been an awesome mentor to me. He helped us design the big study that we have going. I try to keep him as involved as I can in everything because he's absolutely brilliant, and the things that he's doing within the myogenic stem cell population and quadriceps rehab is so fascinating to me. So I keep asking him if I can come and hang out, you know, in his lab and hang out with the human physical therapist for a while. And he said, that's fine, as long as I put a presentation together about how we rehab horses, because I think that's the biggest
What can you do for me?
Well, no, I just think they're all fascinated with, you know, how on earth do you get things like that accomplished on horses?
Well, especially for him being up there in Lexington, you know, where it's like horse central. And also now he has Chris Fry up there, who is brilliant. So whatever you can do we've been really lucky. You know, we had Chris down here at UTMB and now he's up there, but I think some of his work along with Brian's would be amazing for the equine world. Yeah,
it's, you know, I aimed for the fence with this one in my PhD, meaning like I wanted to do something that was totally out of the box and totally different than what had been done before. I wanted to do something novel and cool and amazing. And so I picked BFR, and then I identified who were the big fish in the BFR pond. And obviously Johnny Owens, all of you of Owens Recovery Science are defining that standard. And so I went for it and tried to get to know you guys. Unfortunately, you were super cool and have been amazing. And then Brian Noren was another one of those very big fish that was on the bucket list of, wouldn't it be cool if this person knew who I was? Wouldn't it be cool if this person could help us, you know, push this forward? And it's been such an amazing journey. It's been a wild ride. And we've accomplished so much in just a year's time, where, you know, all of the equine grant mechanisms were turning me down because it seemed crazy. Now we've actually finally gotten some funding, and we're excited to move forward.
So what's that next step? Are you moving into those trials now?
Yeah, in about a month, they will start. They were delayed a bit because of the COVID, but we will start with the big project here in about a month, and we'll go from there. And we're excited, you know, to see what next. I of course have like 10 things down the list that I want to do that are similar to what you all have had to do, meaning what is the exact cuff width that we should be using? Is the pressure that we need the same as what you guys have shown on the human end of things, meaning do we need at least 40%? Could we go even lower than that? making sure the LOP is accurate, making sure that it's safe and it's tolerated, and make sure that in no way, shape, or form does it damage tissues. And I think we will find that it doesn't, but we need to figure out and just make sure that it's safe before we can, apply it mainstream in a clinical setting. So, and it needs to be something that remains very sacred to the field of physical therapy. This is not something that I want a horse person to listen to this podcast and think they can just go out and start doing BFR on their horses, because that's not at all what I'm going for. It needs to be utilized as a rehabilitative tool to transition horses back to the workloads that are when they are safe. And I'll put my plug in for that, but we all want to make sure that it's used appropriately and it's not being, its use is not being misguided.
Awesome. Yeah. Just the freaking orthobiologics question alone, I think y'all can drive us forward so much more, because it's been, Adam, and he's been really trying to get some trials going, but orthopedics is just floundering with orthobiologics, and we have with BFR and orthobiologics trying to define what the question really is, what matters. And, I think we're showing that what we think matters, we can spike it, we can bring it up, but getting a real study where we can see, does that change anything functionally, physiologically? We haven't been able to tap that yet.
Yeah. And, similar to, kind of in that same vein, you guys are, the human field is way further ahead than the horses in tracking workloads and like workload intensity, and making sure that the intensity of workload that an athlete is doing in a practice session matches that or is of similar intensity to the game setting. You guys are way farther ahead than us in that regard. We're still trying to figure out, how we can measure that, how we can track it, and how we can strategize it in the athletic training scenario. But the biologics have been an active area of research for horses for a long time. And I'm not saying that we know more about it than the human side of things does, but we've done a lot of work on the biologics, the PRP. We have more stem cell options than you guys do, obviously, but it's super interesting. And how BFR plays into that, I don't, that again is just like bringing the two giants together. But I do think there's a relationship, and we don't fully understand that yet, but we're getting closer.
Like I mentioned before the call, Adam and I were at the American Academy of Orthopedic Surgeons meeting, and I was discussing right when you were kicking off, and that was the number one thing. He's like, oh my God, we got to find a way to get in with him with biologics. And there was a couple of ortho docs with me, and it's kind of like what Zach said earlier. I had no idea how much translational research we have gotten from the equine world. They're like, yeah, at the conference meetings when their big dogs come here and speak, like we're all there trying to listen, because it's really translationally very important to orthopedics.
We're all fighting the same orthopedic beast, right? It's just on different animals. We deal with meniscal tears, we deal with osteoarthritis, we deal with tendon injuries. The Achilles being somewhat analogous to the superficial digital flexor tendon in a horse, which is the bulk of my work. We deal with enthesis injuries. We deal with compartment syndrome stuff, neuritis, chronic pain, decreases in functional range of motion, and, atrophy, muscle atrophy, weakness, all of those things we have. I think the more that all of us can work together on it, the faster we'll get to a better product.
I think all that's fascinating, Sherry. And I apologize because I cut out my router. I had to reset it and everything. So if y'all have covered this already, then we can forward to the second part of my question. I am very curious about how do you structure a program for a horse, that kind of thing. Did y'all cover that already while I was gone?
We did a little bit, Kyle, but it, it really depends on the horse's original injury. It depends on the extent, severity, chronicity of that original injury. It depends on the biomechanical deficiencies they have as a result of that injury. So do they have secondary pain and muscle weakness as a result of that? And then overall what the horse does for a living or is expected to do for a living thereafter. That whole thing, without going into hours and hours of how we structure the rehab plans, but each rehab plan is custom for each horse. Each rehab plan addresses the specific injury, but also the global strength of that horse. So we work on proprioception, balance, neuromotor control, targeted strength training, resistance bands. We'll use ground pole exercises similar to, the speed ladder work that you guys do, aquatic exercise. But people, like other veterinarians, will always ask me, well, what's your protocol for injury XYZ for a meniscus?
Oh, that's the
Right?
protocol question. You're going to trigger all of us right now.
Yeah. I don't have.
There isn't one.
I don't use injury-specific protocols.
Thank you.
Every single plan that I make is custom from the ground up. I have yet to this day, after rehabbing over 300 head of horses, that I've never built the same exact plan.
Yeah.
Every single one.
Understanding exercise phys, like you said earlier, it's, seeing what you can and cannot do and knowing where you have to get to. So the second part of my question, that was awesome, by the way. The second part of my question is more like a challenge, because what I really think we need from you is some CSM presentations. So we have a big national conference every year. And I think, honestly, and I'm kidding about this, but not really. I'm actually quite serious, because I think too often we live in our own little bubble, like you said, and we need people kind of crossing that bridge and talking. And I think someone like you that has this experience of taking a horse that operates at a high level and presenting within our sports academy, for example, at CSM would be fascinating, because one of the things that I have found in my career is if you're really paying attention, you can learn from people in all different fields. Like one of the best things I ever did in my personal practice was to go out back where we had a hitting coach who was working with kids and just watch how he got them to do certain things, and the simplicity with which he would communicate a complex task that he wanted that kid to accomplish, or the way he would constrain the environment. I'm watching this and I'm going, well, hell, why didn't I think of that for the patient I just worked with? Like that's genius. And it was so simple. And it was from decades of teaching people how to hit a baseball and continuing to learn, because this guy was into all the data and launch angle and all these different things as well. So he was informed, but then there was just this baseline experience that he had that he knew, all right, this particular kid, I can say this thing or do this drill and I can get the result. And now we can work at trying to reproduce that. And so I think someone coming from an animal model, again, where not like you can tell them move this way or do that. I think there's so much that our field can learn from you guys, and it would be awesome to have you. So that's the challenge. And then we can all go have beers at CSM after.
Absolutely. Sign me up, whatever we need to do. I would be in full support of that. And
be great.
I work with, Zach, I've worked with Zach a lot, but I have other human strength and conditioning coaches that I work with, and they're working with the NFL and NBA level athletes, and I pick their brains. We are back and forth all the time, and I've had so many aha moments in those conversations and in those casual think tanks about how I'm approaching rehab of a specific injury and what I need to be doing differently and really thinking outside of the box. And sometimes the best conversations happen after a couple cocktails, when you're really just sitting in, I like to call it sessions where we drink and talk about horses. And I will often do that with some of my mentors when I'm really trying to get to the bottom of a difficult case that I can't figure out. But the human side, you all blow me away. Every time I've ever had a conversation with someone about the athlete themselves. They've gotten so sophisticated on the human end of things that, they're looking at sleep patterns and they're looking at emotional status and, did an athlete's girlfriend break up with him and now it's affecting him? And I have no idea. I think my horse has some level of emotion like that, but we don't know, right? So you guys are able to dive into so many things that we can't. But at the end of the day, the horse tells you if the horse feels better. And the horses that truly love their jobs and have that really strong constitution to go back and do that level of work, like they're amazing athletes, just like the LeBron James, and you know, it's the same type of passion. So I would love that, Kyle.
You got to be careful, Sherry, because I think if you've listened to the other podcasts, you're probably contributing to Kyle's fantasy land, which is a scary place to go to.
No.
I know Kyle has been thinking about if he could treat patients without patients being able to talk. That would probably
I feel
significantly
like
contribute.
Kyle is going to pull like a scroll out of his beard at any point in time and just like unwrap this like magical solution to every problem I have.
He's going to be in the clinic giving patients carrots before they do their exercises like a horse.
Alfalfa cubes.
Exactly.
All right, see if that got them to buy into my program.
Yeah.
Sherry, the course you attended, we kept it in reality. We didn't delve off into fantasy land. You know, that's a left coast.
Hey, look, Zach, we never move forward if we don't look to the future, partner.
You know how weird people looked at me at that training certification? I mean, they were just like, you do what? You want to do what? And to me, I'm normal, right? Because I'm surrounded by other veterinarians. So when you don't get out of your own bubble, like you said, Kyle, like, you know, people,
that's the problem, right? It's like, that's a problem that they looked at you that way. And now it's like, well, hell, we can shake that tree.
Yeah. I mean,
that problem.
I think we've all got similar things we're dealing with.
Yeah.
And it was very high level, Zach. And it was a great course. I would encourage anyone that is on the fence and thinking about it, 100% do it. Like I kind of took a leap of faith and I wasn't sure what would come out of it, but it absolutely blew my mind in terms of the information provided, the level of expertise around the use of the Delphi system, like absolutely blown away.
Thank you. So what's next steps? You see this just kind of research cloud just exploding for BFR and equine, from fractures to tendon to muscle atrophy to angiogenesis to pain maybe.
Yeah, all of those things. And we have a lot of work to do. I mean, the first study that's going to start is going to be huge, and it's going to really lay some amazing foundational work down. But then I think we as a profession, meaning BFR users, whether you're veterinary or human, we can start to have those conversations about what are the next steps that we need to take to really learn more about this technology and to further guide its safe use. And I have tons of ideas and you know, a million steps down the road that I want to accomplish with this research. But yeah, that's, you know, we want to get it to a point where it can be something that's more clinically utilized for certain cases. And it's not that veterinarians have never done it. There are a handful of really progressive sports medicine veterinarians out there that have tried it, but to my knowledge, none of them have done the custom BFR. None of them have done the personalized pressure and really gotten that sophisticated about it. So I'm super excited to kind of blow that wide open.
Dude, I'm so excited. I want to just go work equine now.
Y'all need to come down to Whitesboro and hang out.
I'm doing that 100%. That's exactly what I was going to say. I'm like, I want to come hang out. I want to spend a day or two and just see what y'all do.
You have a standing invitation, Kyle. And
I'm in. Yeah.
The most badass stallion that we have rehabbing there. We got it.
I can ride that.
Yeah, exactly. Well, maybe not ride it, but
maybe not.
Yeah.
I know where not to stand at least.
Yeah. I won't get hurt. I kept Zach safe. So.
Yeah, barely.
Surely I can keep you safe. I just don't want your beard to like scare the horses. Like I don't know how some of them will feel about the beard. You know.
Let me know what grooming I need to make, and we'll see. If I need to mask up, we can.
Yeah. They'll just look at you and think that the mane is on the wrong side. It's,
Yeah. Well, it is.
We can braid it like you do the little horses.
Johnny,
We need some
that's what we
ornaments
had-
for Christmas. I can put the ornaments in if that.
That's what we had to do to keep the cuff on. We had to braid the mane.
Yeah. And,
Yeah.
knowledge bombs like that, that's how Zach is getting, shout out in my PhD dissertation, Dunkel et al.
Because he knew how to braid?
It's because I come up with the idea. I was, thinking on my feet.
He's an idea man. He's a problem solver idea man for sure.
I agree.
Yeah.
So
funny.
The pictures and videos that we've seen is so cool. I can't wait for the papers to get out there and you to start doing presentations for us as well. And I think we're going to learn a ton from this. So
You need a combo course one of these days, a human/horse.
So you need to go to their website, check out these case studies, check out just the horse underwater treadmill is worth time alone. My favorite case study, Champagne, that was my favorite horse on there. I mean, she or he, I didn't really look close enough, but it got yoked from start to finish.
That mare is a badass. Johnny, you picked a good one.
Did I? All right.
Totally badass.
Big Will. I like Big Will as well, but Champagne really got my eye. So.
Also badass.
It's all that West Texas upbringing coming back there.
It is. God dang! If I was barrel racing on Champagne, crushed it in Crane, Texas, man. I would have crushed it.
She would eat you for lunch, Johnny. I hate to say it, but she is like a Ferrari, and
she looks like it.
Yeah. Totally cool.
Well, thanks so much for coming on. This is very, very cool stuff. I think it's going to get a lot of people interested in just hearing from your side of I can already hear all the PTs like, I want to get into equine and start doing equine rehab now too. So watch out, Sherry. You're going to have a lot of us posers trying to get into your lane, which we don't need to do.
They'll run up against one bad one and they'll have enough of that.
Yeah, exactly.
Yeah.
Well, cool. Well, thanks so much for coming on, Sherry.
Yeah.
Thank you guys for having me. Loved it.
Cool.
Yeah,
Let's stay in touch.
Thanks for listening to the Owens Recovery Science Podcast. Owens Recovery Science is a single source for PTs, OTs, ATCs, DCs, MDs, and other medical professionals seeking certification in personalized blood flow restriction rehabilitation training. Find them online at owensrecoveryscience.com.